Hangad ng health Hangad ng Healthy Philippines Alliance na mapabuti ang healthy eating habits at diet ng mga Pinoy, lalo na ng kabataan. Isang mabisang paraan ang pagpapatupad ng mandatory front-of-pack labeling. Hangad ng Healthy Philippines Alliance na mapabuti ang healthy eating habits at diet ng mga Pinoy, lalo na ng kabataan. Isang mabisang paraan ang pagpapatupad ng mandatory front-of-pack labeling o food warning labels. Isa ito sa mga mabisang panlaban sa noncommunicable diseases o NCD sa Pilipinas. Kasama na riyan ang heart disease, diabetes, cancer at chronic kidney disease. Sa sistemang ito, dapat may label sa harap ng mga pakete ng ultra-processed food and drinks. Tutukuyin nito alin ang sobra sa asukal, asin at taba na masama sa kalusugan. Hangad ng Healthy Philippines Alliance na mapabuti ang healthy eating habits at diet ng mga Pinoy, lalo na ng kabataan. Isang mabisang paraan ang pagpapatupad ng mandatory front-of-pack labeling o food warning labels. Isa ito sa mga mabisang panlaban sa noncommunicable diseases o NCD sa Pilipinas. Kasama na riyan ang heart disease, diabetes, cancer at chronic kidney disease. Sa sistemang ito, dapat may label sa harap ng mga pakete ng ultra-processed food and drinks. Tutukuyin nito alin ang sobra sa asukal, asin at taba na masama sa kalusugan. Ang food warning labels ay ginagamit ng mga bansa sa Latin America mula noong 2016. Kabilang narito ang Chile, Argentina at Mexico. Simple, malinaw at praktikal ang food warning labels, kaya madaling maiintindihan ng mga mamimili. Sa isang tingin, alam mo na kung alin ang hindi mo dapat bilhin o kainin. Kapag ipinatupad din ito sa Pilipinas, mapuprotektahan ang kalusugan ng bawat pamilya. Hangad ng Healthy Philippines Alliance na mapabuti ang healthy eating habits.
Hello. Okay na po tayo. Na-drain na po ba ang mga bladder? Alam niyo po, hindi niyo po na itatanong. Si Pat Mangune po, yung from our organizers po sa HPA at saka sa Health Justice. Ay reporter po ng TV5 dati. Ayan no, kaya po baka familiar face po si Pat. Ayan, si Pat Mangune. Shall we proceed na po ba? Okay, please settle down na po. Mga ma'am, sir. Parang ano no, ilang oras na tayo? 1, 2. Almost 2 hours pa lang pero ang dami nang nangyari. Parang lalong dumarami yung tanong ko eh. Kaya lang mamaya na raw eh, sabi ni Pat eh. Meron po ba tayong representatives from Senate or House of Representatives na nandito? Ayan. Okay na po. Shall we proceed na po ba? Okay po. Okay. Moving on with our program, the University of the Philippines Manila also obtained data from their research on the FOPL warning label. To share with us some details on this, please welcome Associate Professor of the Department of Health Policy and Administration and the Assistant Dean for Planning and Development of UP Manila College of Public Health, Dr. TJ Robinson T. Moncatar. Tama ba ako, sir, ng pronounce ay yung pangalan? Ayan. Parang babata ng mga doktor, no? Sir.
Alright, thank you very much po, Sir Sander. Just a disclaimer. If FNR ay presented a full study already, kami po magsa-start pa lang this year.
Oh.
So wala pa kaming results. Hopefully, based on the video shown earlier, naka-warning label kasi yung pinaka-focus. It was mentioned earlier by UNICEF, then sa Healthy Philippines Alliance through the video that they were sharing a while ago, nandun din kami naka-focus. So yun yung iti-test namin. If that would really also apply, or yun ba yung gusto talaga ng mga consumers natin, looking on the behavior of their intent to purchase. So that's what we want to measure in terms of effectiveness for this particular randomized controlled trial that we are again going this year. So we are the collaborative research partners of Johns Hopkins University. So us in the College of Public Health, so it's not just my department, health policy, but together with most of the departments of the College of Public Health, including health promotion, nutrition, and epidemiology and biostatistics. So nag-team up po kami to actually do this particular study. So we have 3 phases, starting from qualitative, focus group discussions, up to randomized controlled trials. All right. So I think we were basically discussing for this day in terms of very importance of policy. So susundan ko what Imagine Law actually emphasized earlier, that we really need the policy to definitely change the behavior of the people to choose nutritious food and them to be aware really of what they are actually buying. So what we want to really generate is an evidence, particularly a front of package warning label, that hopefully will be used as an evidence for us to further push the policy that we are actually putting in now sa Congress and the Senate. Next. Okay. All right. Sorry. So what we would want to emphasize is a combination of a nutrition label, normally the nutrition pack. Now, commonly it's already provided in most of our commodities as of the moment. Then now, we want to take the opportunity of we also have a label on the front. So it's either, for example, now we have logos, right? Then in other countries, they use a traffic signs, grading scores. Then in other countries, particularly in South America, they're doing warning labels. So we would want to take that particular opportunity in the future. So now, okay, all right. So it was also emphasized earlier that there's a lot of mechanisms that is actually being used. Either it's a nutrient-specific system that some are actually voluntary, in other countries are actually currently being mandatory. In the Philippines, we are more focused as of the moment in terms of voluntary logo or labeling use. So, of course, we would want to ensure or identify later on what would be the best label or a mechanism that we would actually want to use. And definitely pushing towards a mandatory labeling. So again, that's where the evidence will play in, and yun yung gusto po naming mangyari, ano? Later on, I'll be discussing and providing our methods to actually end on that, all right? So at the same time, so based on literature or based on the research studies that we are actually conducting, we were able to identify that endorsement logos or nutrition to encourage on front of package labeling are actually not recommended. It could be logos, nutrition scores, traffic lights. So that's why we're more keen really in terms of the warning label. So that's what we are trying to aspire. Kaya yun nga po yung gusto naming i-test. If that would really be, that if it would really somehow influence or change the behavior of our consumers in terms of the intent to purchase. So at the same time, another disclaimer that I forgot to use to provide earlier is the particular design of the study that we are doing right now, or we're going to do here in the Philippines, the same design that we did in Ethiopia, 2021 to 2023. So now we're replicating the methods, the research design here in the Philippines. The only difference, in Ethiopia, they only did it in one city. But here in the Philippines, similar with what FNRI did, we're going to do it Luzon, Visayas, Mindanao. And on at a bigger sample size. So yun yung magiging difference namin for this particular study. So it was mentioned earlier, there's a lot of evidence showing that in most countries, voluntary policies are actually very common. And if you would look on the map, the global map, it's actually scattered everywhere, mostly in Europe and in Asia. So very common logos, traffic labels, for example, nutrient scores, very common being used in this part of the globe. However, if we, next. Yeah. However, if we go or look at South America, diba? So, and even Canada, way up in the North America, no? Mandatory policies of utilizing or providing warning labels in different commodities, it's actually commonly being used there. And it started around 2014 and up to the present. Okay? So we're banking on this particular evidence as well, but of course, hopefully, right now, we really don't know yet if that would we will have the same results like South America. So yun yung ano namin gagawin, and we will try to identify if hopefully we will have the similar results with what happened in South America and on the first area that we did this particular research sa Ethiopia. Okay. Now, so mandatory policies are always recommended, or this is what we're pushing in a way that voluntary policies have been always identified to be manipulated and selectively adopted to showcase brands and healthier options. So somehow there's confusion, like it's a junk food, pero nakalagay it's healthy, diba? So it creates confusion, and somehow it's being taken advantage of different companies. That's why we're really pushing again on the warning label that directly tells you it's high in sugar, it's high processed food, high salt, etc. No? And even the color black, the first time I actually engaged with front of package study. So my question is, why it's actually black? So my counterparts really explained to me that the black not necessarily just tells you it's dangerous, but at the same time, normally our products are colorful. So if you put something in the front that is colorful, so the tendency is you're not able to see it really, right? Because red, for example, the chippy, for example, right? Chippy. So sorry if rin po pakat So ganung product. Then the logo is red, for example. So it's not easy to see or really interpret, even though the word high in sugar is very big, but the colors might have some effects, diba? So that's apparently So then that changed my impression about warning labels before when I was starting this. And it's actually the most common mandatory FOPL. I like the policy brief shared by Healthy Philippines Alliance. I was actually reading it as well. It really provided us information on the various types of FOPL, but several researches already provided us a lot of information about this type of FOP, or plant of package label. So definitely it does not allow for positive nutrients to compensate for nutrition of concern. It's very easy to interpret. There's no health halo effect from any other possible signals. Then definitely in RCTs that was previously conducted, it provided us a change in behavior, particularly in terms of the intent to purchase. Now, that's what we're going to test here in the Philippines. Because, in terms of evidences, if it works in other country, not necessarily that based on our context, the result will also be the same. That's why as researchers or scientists, yun yung test natin, di ba? Of course, we always have assumptions, we always have hypotheses, but at the end of the day, we need to consider the environment that where we're in and to test the intervention that we have. That's why this particular research is a very good example of an implementation science research, that we have an intervention or strategy that we are going to test here in our country. Okay, so mentioned earlier, actually, in a way, Chile is what we're following in terms of the evidences. So they're one of the first countries to actually implement the particular warning label, focusing on providing high in calorie, high in sugar, high in saturated fats, and high in sodium. Okay. Now, so let's go now on what we're going to do here in the Philippines. So we're going to do a randomized controlled trial of a plant of package warning label here in the Philippines. So basically, we want to know if which one is the most effective front of package label for consumers in the Philippines. Very strategic in a way that some of you guys already did your research. You might have able to design your front of package label, so we can also test it together in this particular study that we're going to do. Later on, I'll be discussing the ARM. So we have an opportunity on that to really know if which one would tend to change the behavior or to measure effectiveness of a certain front of package label. So, also, we would like to highlight that we are focusing on the clarity and understanding of the label, and not necessarily on how it looks like or even likability. So really, again, focusing in terms of effectiveness. And again, our outcome is if it will change the intent to purchase of consumers. Okay. So as I mentioned, this one, our partners, so of course here in the Philippines, it's the College of Public Health, but we are, of course, our main research partner. We're working closely together with them, almost twice a week or even once a month meetings. So Hopkins University as our research partner. Of course, we're also working together with Global Health Advocacy Incubator, Vital Strategy, at the same time our partner, which is Resolve to Save Lives and Bloomberg Philanthropies. Okay, now, I just want to quickly highlight our design. So we have 3 phases. First, we're going to do focus group discussions, us to know more and explore on purchasing behavior, nutrition behavior, challenges, and understanding on existing nutrition labels. Also try to contextualize and refine the design of the front of package warning label that we have as of the moment. You know, getting comments on that black label, like how do they find it, things like that. So we're going to do a focus group discussion among adults who purchase food. So it's Luzon, Visayas, Mindanao. So we have around 4 study sites that we're actually doing. So at the end of the day, we want to have a warning label that is that consumers across geographic, socio-economic, and age sectors in the Philippines will find visible in terms of packaging and understand. Now, the next step, we want it to be more inclusive. So this is where we're going to engage with all or most of you. Because the label that we are able to identify or develop during FGD, you guys are going to be our partners. So For example, Department of Health, NNC, FNRI, other government organizations that we were not able to include, and non-government organizations, or even other partners from the private sector. So we're going to closely work with you, and let's scrutinize the design that actually we are developing for us to have a final warning label that is easy to understand by consumers, attracts attention, highly visible, and the next step is we're going to test it with against other labels or system. So that's our collaborative process. And lastly, well, for the expert survey, definitely we want to get your feedback, participate, and assist us to finalize it. All right? So we're not just doing it, us, the researcher, and later on, pipresent na namin sa inyo. Ano? So, hawak-hawak tayo to have a, kumbaga, somehow a good design that eventually, again, would change the behavior of our consumer. And lastly, we are going to do a randomized control trial. It's a 4-arm randomized control trial. So we have 1,200 participants based on the calculation of our sample size. Then at the same time, we are focusing on adults age 18 years old and above who actually purchase food outside of their household. This is a street intercept methodology. So from supermarkets, grocery, markets, doon namin sila kukunin. So we want to get an evidence now that would support policy development. So this is a policy, this is the result that we have. So going towards knowledge translation and dissemination, for example, we are going to recommend to the Department of Health or the technical working group that we have as of the moment based on the results of our result, right? So again, right now, we don't know if in our context, what would be the best label. And that's actually what we're going to do. Next. Yeah. Again, this is a same research that we already did in Ethiopia, just recently conducted in 2023, and we are going to start it here in the Philippines 2024. Just an example, this is the final design phase na nabuo in Ethiopia. Basically, it just tells you high in sugar, high in salt, high in saturated fat. It was shown in the video earlier. So, ito yung final design that was developed through FGDs, expert survey. They did the randomized controlled trial using this design. And this is how it looks like with the product. You see colorful products with a black label in front. So this is the final design phase na pinakita nila during focus group discussions, during survey, and during RCTs. Because, this is the RCT that they did. So we have 4 arms. First, we have no label. We have our warning label, which is the final developed design. We have a guided daily amount. Then we have a Nutri-Score, which is our traffic light. So this is what we try to compare. It looks like this. Yan. Right? So this is what we tested. Now, again, it was repeated 4 times with 4 different products. Basically focusing on the intent to purchase. If you were able to see this particular chips, then looking no label, a warning label, then the other 2 labels. So, are you going to buy this particular food? Diba? Now, the results showed that the warning label actually showed a lower probability or a probability of them purchasing actually the food with high salt and high sugar products. So basically, it's shown effectiveness as compared with the other 4 arms because if you would look at it, the odds ratio is actually higher as compared with the warning label, which actually showed lower intent to purchase. So in a way, the warning label actually was effective to change the behavior of the people to purchase unnutritious food or unhealthy food, which is particularly high salt, high product. So, the evidence that we were able to identify in Ethiopia is the design phase, FGD and expert survey, we were able to develop a clear and effective front of package warning label. Designed not just by the consumers, but also the experts. Then at the same time, the front of package warning label was more effective than no label, multiple traffic light, and Nutri-Score at reducing the intent to purchase packaged food high in sodium or sugar among Ethiopian consumers. So that's the evidence that they have now. And that's what they're using right now to move further the policy in Ethiopia in terms of embracing the front of package warning label. Right. So I think it's time's up ako, but I'll just rush a bit. So of course right now we're using global best practices. We're adapting the lessons learned in Ethiopia and of course experiences of our research partners in Hopkins. And at the same time, we are banking on the knowledge of you guys, of our network of different partners, in really crafting a somehow sensitive warning label that really considers our context. Then at the same time, from our end at the College of Public Health, it's more interdepartmental, not just one department. Like for example, I'm more focused on policy and administration, you know, like embracing evidence and translating it into policies. In terms of context, we also have partners on that. And at the same time, the local and global network. So the local network that we have right now, the global network. So we're going to somehow take that as an advantage in the development, implementation, and evaluation of the warning label. So this is our timeline. As I mentioned earlier, we do not have an evidence yet, but hopefully at the end of this year or early next year, we're able to provide to you the evidences. So as of the moment, we're in the technical clearance or ethical clearance process here in the Philippines and also in Hopkins. So that's where we are as of the moment. But all of those spaces, we're going to do it in the next 9 months. So that's actually our target. All right. So that's all. So thank you for listening. And definitely we're looking forward for a healthy partnership with each one of you. So thank you very much for the invitation. And really very happy that even we're not yet implementing the research, you were already able to identify us doing this particular research. So mabilis yung balita. Oo, ang bilis. Right, so I was actually telling DOH, paano nalaman? So very surprising kasi nga ethics pa lang kami, right? So thank you very much, guys. Thank you.
Thank you po, Dr. TJ from the UP Manila. Thank you, sir. And now to reveal to us the results of a nationwide survey on FOPL, hindi po tungkol sa mga possible senatoriables next year, o kaya po kung sinong mas gusto nyo, kung anyway, sir, sorry ha. The Senior Survey Specialist and Program Manager of the Social Weather Stations or SWS, laging laman po ng balita, Mr. Christian Michael Entoma. Good morning, sir.
Thank you, Sander. So I'm here to share with you some results from a survey that we conducted for Health Justice Philippines. So it's a survey on front of package labeling, and the survey module consists of 6 questions. And it was conducted during the first quarter of 2024 Social Weather Survey. So the Social Weather Survey is an omnibus survey covering a plethora of topics, mainly about quality of life of Filipinos and some other salient concerns at the period. Okay, so the fieldwork dates were from March 21 to 25. So those were the dates of interview nationwide. We had a sample size of 1,500 adult Filipinos nationwide. So it's broken down into 300 sample in NCR or Metro Manila, 500 in balance of Luzon, 300 in Visayas, and 300 in Mindanao. So next page, please. Yes. Oh, okay. So I'll go through the slides as quickly as I could. So for the first question, we asked, the following are examples of different nutrition labels pertaining to one food product. which of these most clearly indicates that the food product may be harmful to your health? So we showed them 4 types of nutrition labels. The first one is the black octagonal labels, the warning labels. The second one is the Nutri-Score format, as you can see there. The third one is the health star rating, and the fourth one is the traffic lights nutrition label. So when we implement this in our face-to-face surveys, we shuffle the sequence of the cards and then show them all to the respondent, and a respondent is only allowed to choose one answer because the question was, which of these most clearly indicate that the food product may be harmful to your health? And the survey found that 3 out of 5 identified that the black octagonal warning labels most clearly indicate the health risks on food products. So this is followed by the 14% who point out the traffic lights, 10% who point out the Nutri-Score label, and 9% who identify the health star rating. So if we look at the other results through demographics, so the percentages of those who say the black octagonal warning labels most clearly indicate health risks are higher in NCR, Balanced Luzon, among classes A, B, C, the upper to middle classes. In the next slide, it's higher among those, the older age groups, the 45 to 54 and the 55 and above, and among high school graduates and college graduates. Sir, meron ba tayo nung format na yung isang page lang per slide? Oh. Ito na so. I see. Okay. So nag-combine siya ng page. Okay, sige. Okay. So you can see there that that's the pattern. So it's higher among the older age groups and the higher education groups. So but you can see across the board, majorities identify the black octagonal warning labels consistently. So it's just especially higher among the groups that I mentioned. Okay, the next question focuses on it still focuses on front of package labeling, but it asks, how often do you read nutritional information or nutrition facts like this? There's a sample of a sample nutrition facts on a product that is shown to the respondent when buying packaged food products and beverages. So the survey found that 30% read often, that's composed of 12% who read very often and 18% who read often. And about 1/5 read sometimes, and 1/3 rarely read the nutrition facts. And there's 12% nationwide who say that they never read the nutrition facts when buying packaged food products or beverages. Okay. So if we look at the following slides, those who often read nutrition facts when buying food and beverage products are higher in the following groups: in Metro Manila, in Visayas, in urban localities, among the classes ABC, and among women. So for the next slide, it's also higher among the younger age groups. So that's 18 to 24, 25 to 34, and 35 to 44 compared to the older age groups. And again, to the higher educated groups, the high school graduates and the college graduates. Okay, so for the next slide, we ask, in your experience with buying food products and beverages, how easy or difficult it is for you to understand the nutritional content or nutrition facts on food product and beverage packages. So we use what we call a show card or a visual that shows the response categories. So those who said the nutrition facts are easy to understand are about 53%, and this is composed of 17% who say these are very easy to understand, and 36% who say these are somewhat easy to understand. There are 20% who are undecided about this, and 27% who say that the nutrition facts are difficult to understand. So that's broken down further into 18% who say that these are somewhat difficult, and 8% who say it's very difficult. So net score is a summary indicator. The plus 26 is showing the difference between those who said that the labels are easy to understand and those who say that it's difficult to understand. So this is on the positive side. So it shows you that the difference is about plus 26 when you compare the two sides. Okay, so for the succeeding two slides, we will see that those who say that nutrition facts on food and beverage products are easy to understand are, it shows a familiar pattern. It's higher again in Metro Manila, in Visayas, in urban areas, and classes ABC. For men and women, there's not much difference. And when we look at age, again, it's higher among the 18 to 24 age group and the middle age 35 to 44, and consistently among college graduates. Okay, that's the third question. For the fourth question, we ask if you see this type of nutrition label, we show the nutrition, the warning label saying high in sugar, high in fats, high in saturated fats, and high in sodium. We did, let's backtrack a bit. We did a cross-tabulation on the degree of ease or difficulty in understanding the nutrition facts by the frequency of reading nutrition facts. So this chart just shows you that if one reads more frequently the nutrition facts, the more likely they would say that it's easier to understand. So it's somewhat expected finding. So it's directly related. The frequency of reading nutrition facts is directly related to the assessment that the nutrition facts are easy to understand. So that's what this slide is saying. Let's go to the next slide next slide from this. Yes. So it will show you that those saying that the nutrition facts are easy to understand are higher in NCR, Balanced Luzon, urban areas, and this slightly among classes ABC. I forgot to highlight that. For the next slide, it's higher somewhat among among the 35 to 44 and the 55 and above, and high school and college graduates. Okay, so let's go to the next tabulation. So this table, this chart tells us that for the degree of health benefit, that's slide 27. Okay, so among those who say that the black octagonal warning labels most clearly indicate the health risks on food and beverage products, there's 50%. When we look at this first oval, there's 50% who say that 50% say that it indicates that the product is not beneficial to health. It's also notable that when you see the ones who assess the Nutri-Score label as the most effective in saying the potential harm of the food product, the opposite pattern is observed. So there are more of them who say that the food or beverage products is beneficial. Okay, so so in this table, we tried to see the relationship of the frequency of reading labels with one's assessment of the black octagonal warning labels in telling whether the food product is beneficial or not beneficial. So it tells us, in a nutshell, that the frequency of reading nutrition facts when buying packaged food or beverages has little impact on whether people would say that the black octagonal labels would say that the product is not beneficial. So you will notice the red bars are consistently high across categories. So doesn't differ much from the national average in the first bar in this chart. Okay, so let's go to the next slide. The next slide asks about if a law will be passed about putting nutrition labels on the front part of food and beverage packages indicating high in sugar, high in salt, high in fat, etc., would you definitely support, probably support, are undecided if we'll support or not support, probably will not support, or definitely will not support such a law? So the survey we found in the survey that 2 out of 3 will support such a law. So the 66% is broken down into 39% who say they will definitely support such a law, and 18% who say they will probably support such a law. So the 19% are undecided as of the survey, and only 15% say they will not support. So that's composed of 6% who will probably not support and 9% who will definitely not support. So looking at the summary figure, the net figure, it indicates a strong support for a possible law that would require FOPL. Okay. So when we go down the line by demographics, so the support is consistent. Majorities across socio-demographics and areas will support such a law, but it's especially higher again in Metro Manila, Balance Luzon, this time in Mindanao, among classes A, B, C, and for the next slide, it's also higher among the 35 to 44 and high school and college graduates. Okay, so for what we found in that question is that any law that's about in our experiences in past surveys, any law that is beneficial to the general public usually receives a high amount of support from the public. Okay, so this is another example of that. Okay, so then we go to this is the 6th question of the survey module of health justice. So we showed these 4 sets of pictures, which are essentially warning labels. So the question was, if you see these types of nutrition labels on the front part of the packaging of food and beverage products, which one, in your opinion, conveys a more explicit warning about health risks? So respondents are allowed one answer only. Again, these pictures are shuffled before they are shown to our respondents just to avoid what we call a sequence bias. So number one is not always the first one shown. It could be number 4, it could be number 2 the next time, it could be number 3, etc. So what's important is before the respondent chooses his or her answer, the sequence of the pictures are always randomized. That's what we make sure of. And it shows that the mataas sa format is identified as the most explicit by 1/3 of Filipinos nationwide. So they are followed by the 23% who identify excess as most explicit, the 23% who identify the sobra sa format as most explicit, and 21% who say that the high-in octagonal labels are the most explicit. So you will notice this pattern all throughout the other slides. So it would show you for the next slides that yes, it's higher again in NCR, Balance Luzon, Mindanao, in urban areas, among the upper and middle classes, ABC, the Class E, and by age, it's higher among those who are 25 to 34, 45 to 54, and the 55 and above. The exception is that the 18 to 24 identify the high-in format as the most explicit. Pero syempre in English mo lang yung mataas sa eh. So it's basically the same. Okay. So the good news is in across education groups, this is very easily identified as explicit. So in terms of our information and education campaigns, I think we're in somewhat a good place right now if we look at the results. So that's the end of our presentation. That's the survey module of we did for health justice, and that's our office in Sikatuna. So you can contact us if you have questions using the following information. So with that, I thank you for your time. Maraming salamat po sa lahat.
Thank you, Sir Christian, Michael, and Toma of Social Weather Stations. Thank you, sir. Nice to meet you in person po. Thank you. And two of our speakers were supposed to join us live, no? From the United States of America. But, pero nagpadala na lang po sila ng video. So hindi na po tayo mag-wee break. Since hindi naman sila live, pwede naman na kayong sumaglit-saglit habang nagsasalita sila. So, we shall proceed now and listen to the best practices in FOPL policy in the global stage and the challenges of interference from the food and beverage industry from the Global Health Advocacy Incubator Headquarters in Washington, D.C. Ms. Sofia Patino, the Associate Director for Advocacy for the Cardiovascular Health Program, and Ms. Nadia Flexner, the Associate Director for Research for the Cardiovascular Health Program. Please watch this.
So I want to start
30
by
minutes
first
nga.
defining what
Mahaba,
informs a front of pack
Oh, sige
labeling.
na nga.
How
Hindi
do we
nila alam
define
yun.
what is less healthy or healthier within certain food categories or in foods? So how do we recognize, for instance, in this example, which one is less healthy or healthier, which one has higher sodium amounts, sugar, we're very pleased to present today on global best practices. We can look at at the back of pack nutritional information. We can look at the different levels. Do we look at the profile models in front of pack labeling, as well as some country experiences on policy enforcement and some challenges during the implementation phase. So I want to start by first defining what informs a front of pack labeling. How do we define what is less healthy or healthier within certain food categories or in foods? So how do we recognize, for instance, in this example, which one is less healthier or healthier? Which one has higher sodium amounts, sugar, etc.? We can look at the front of pack, at the back of pack nutritional information. We can look at the different levels. Do we look at the number of ingredients that each product has? How do we define those? How do we define, how many, this is just an example, but how many warning labels a product can display or not? So this can be informed by nutrient profiling, which has been defined by WHO as the science of classifying or ranking foods according to their nutritional composition. So we have a set of inputs such as the level of saturated fat, sodium, or sugars. Then we use algorithms or rule of operations to define or classify a food product as being less healthier or healthier. For instance, in the case of front of pack labeling regulations, the output will be if the product display or not a warning label, or if it has if it's under a score system, which score the product will display. So nutrient profile model allows comparison between foods when some nutrient levels are higher and others are lower. And also, it's important to know that it categorizes foods as opposed of diets, but can definitely improve the nutritional quality of diets, can be used to improve the nutritional quality of diets. So defining a robust nutrient profile model, it's important because this informs several food policies. For example, it can inform which products will display or not a warning label in the case of front of pack labeling, which products will be restricted from marketing, also regulations in school environments, if the product will be taxed or not, or subsidized, or if the product will carry or not a nutrition claim. And these are just some examples of the focus of our talk today, the front of pack label designs. So nutrient profiling has been used worldwide as a health promotion and NCD prevention tool. This recent systematic review found more than 380 nutrient profile models, and from these, only 78 of them have been applied in nutrition policies and being endorsed by governments. The other nutrient profile models have most likely been developed for academic purposes or used by food industry. And for instance, most of these nutrient profile models, according to this systematic review, has been used for school food standards, guidelines, front of pack labeling, and marketing restrictions. And most of these models target nutrients to limits such as sodium, saturated fat, and total sugars. Interestingly, in the last 4 years of this systematic review, so between 2016 and 2020, 26 new nutrient profile models were identified. And I just want to highlight this, that in these years, the proportion of models that include nutrients or food components to encourage decreased substantially, which speaks a lot of what is the current public health nutrition recommendations, right? To focus on nutrients to limit instead. So when we define a nutrient profile model, we have nutrient profile models that are more nutrient-specific systems and others that are summary indicator systems. So for instance, the nutrient-specific system rate a product on individual nutrients, so nutrients of concern. And for summary indicators, some of these examples that I'm showing, for instance, as the Nutri-Score, they take into account also nutrients to encourage within the algorithm. But why is key not to include nutrients to encourage in a nutrient profile model? Well, first of all, it does not reduce the health damage associated with excessive nutrients and ingredients of concerns. Also, does not allow consumers to understand individual levels of nutrient ingredients of concern as well. So it can also have, it can divert the purpose of the policy and decrease the effect of the policy in this case. And we've seen this in other countries. It also increased consumer confusion when comparing one product versus another within the same categories. Also, nutrient profile model systems mirror the positive nutrient approach used by the food corporations globally to reformulate ultra-processed products. So at the WHO level, there has been many recommendations to reduce nutrients to limit. And ideally, a nutrient profile model will incorporate these recommendations within their definitions. So, for instance, this is we're learning with experiences from countries, and this is an experience from Chile, for instance. In Chile, the nutrient profile model that they developed, well, first of all, it was the first nutrient profile model developed by, that it was relevant for multiple mandatory related health policies. So the law in Chile incorporates from pack labeling, marketing restrictions, and also school environment. So restricts the availability of these products with carrying a high label in school food environments. But what happened in Chile is they did not include non-sugar sweeteners to the nutrient profile model. And some evidence from early evaluations show that NSS was frequently used pre-implementation of the period, given some country context, but the post-implementation period, NSS use increased significantly, specifically among children. So the use of NSS increased from 38% to 44% almost after implementation of the law, which is significant. And also what we have observed is that reformulated products that reduce the sugar content below the low, the thresholds were more likely to start using NSS in the post-implementation. So countries are learning from these experiences, and after having these evaluations, we have the experience from Mexico, from Argentina, and they have incorporated within the nutrient profile models NSS and also caffeine. Okay, and here in this table, I just wanted to show you these are three models that we are comparing. These are three WHO models, the CIARO, PAHO, and AFRO. And all of these models are based on recommendations for nutrient dietary goals. And you can see there are many similarities, but other models have, like for instance, PAHO is the only one who incorporate NSS. So it does tell you if the product has an NSS, it has to display a label. And also there's another difference. For instance, PAHO only applies, one threshold for sugars, for free sugars, whereas AFRO and CIARO, they do disaggregate by solids and liquids. So 10% for solids and 5% for SSBs. So related to how, the industry usually opposed to the adoption of some nutrient profile models, we've seen in different countries that the behavior is usually, opposing to best practices nutrient profile models. For example, the PAHO nutrient profile model. Also, proposed nutrient profile models are usually what they propose is by serving size. And we've seen, this in many countries that it's easier to manipulate some of these food categories. But also, the recommendation is to have by food category and not apply to the whole food supply or differentiated by solids and liquids, which is easier to implement and to monitor as well for countries. Of course, they promote less strict thresholds, and they push for a higher number of food and beverage categories, as I mentioned, and there is a strong lobby to introduce nutrient profile model based on scoring systems that highlight nutrients to encourage. Okay, so what are the benefits of adopting a regional model versus developing a new model? So adopting WHO regional nutrient profile models, it has rigorous standards like the PAHO, CIARO, and AFRO. It also requires fewer resources and shorter timeline for policy design and implementation in countries. So the use of this regional framework also helps with possible political, judicial, or administrative challenge that we're seeing and you can encounter in the implementation phase or the adoption phase. So also it's important to continue to monitor implementation experiences in other countries and see what we are learning from these experiences as well and incorporate to improve our nutrient profile. So ideally, nutrient profile model should be consistent with WHO recommendations. It should be relevant across populations, so not divided by by children or for adults only. It has to be ingredient and nutrient specific, and ideally it will apply to 2 categories, so solids and liquids, and not to multiple categories. Also establish one threshold for each nutrient and ingredient of concerns, and apply to processed and ultra-processed products in your food supply. So I will quickly go through front of pack label and what's the purpose of the policy and some country experiences so far. So front of pack labeling has been recognized by public health organizations as a cost-effective policy to promote healthy diets. And I think there's agreement on this in most countries as well, and it's a recommendation from WHO. And the purpose of this policy is to identify products that are in excess of nutrients of public health concerns, such as sodium, sugars, and saturated fat. So quickly, just want to show you this figure that I really like from UNICEF. It illustrates the pathway through which front-of-pack label policies influence the consumption of products high in nutrients to limit. So, as I mentioned, the purpose of this system is to provide consumers with clear and easy to understand nutritional information on packaged foods, and to indirectly motivate the food industry to reformulate their food products. So these actions in turn will help consumers in making healthy choices, which has an impact on diet quality and ultimately resulting in health improvement and potential healthcare cost savings. As we know, there's increasing international momentum for front-of-pack labeling policies as a regulatory initiative. And as you can see in this map, these policies have been implemented around the world in either a voluntary or mandatory basis. So some examples from Chile, and I'll be happy to provide more information about these evaluations. But in Chile, evaluations of the first phase of the policy shows a decrease in purchasing of high-end labeled beverages. This was up to 24% compared to expected purchases based on pre-front of pack labeling trends. So another study examined changes in the calorie, sugar, and sodium saturated fat content of food and beverage purchases. And after the first phase of implementation of the Chilean policy, results shows that there was a significant decline in targeted nutrients. For instance, we see that overall reductions of 3.5% in calories, 10.2% in total sugars, 3.9 in saturated fat, and 4.7 in sodium. And these are overall, right? You can see that yes, it decreased the critical nutrients for products that carry a label, but increase the consumption of products that do not carry a label. So clearly, consumers are choosing products with less labels or changing their consumer behavior change. Also, national representative surveys show that a year after the implementation of the Chilean law, at least 30% of respondents declared choosing foods with fewer high-end symbols after comparing labels. And in 2018, this proportion was of 58%, and in 2019, 72%. So consumers are more and more familiarized with these labels and are using it as well. So this is evidence from Chile, but also in Israel, early evaluations show that at least 70% of participants declared their willingness to choose healthier alternatives after implementation of the policy. And with this, I'm going to give the floor to Sophie. Sophie, over to you.
Thank you, Nadia. And good day, everyone. It's a pleasure to be here with you. And this part of the presentation, I will be talking on the front of package warning labels, the policy enforcement, and the challenge of industry interference. Next slide, please. So to start with, it is important to understand that Chile was the first country implementing this front of package warning labeling. As my colleague Nadia said, this was back in 2016, and from there are more than 9 other countries that have adopted the front of package warning label, and most of them have already implemented. So these examples that I'm going to go through are from these countries that have already implemented and the policy in place in the country. Next slide, please. So let's start with Chile. So let's focus here in the first product, that is a chocolate, the yellow one. So as you can see, at the beginning of the implementation, industry were using multiple front of package labelings to confuse consumers. So as you can see, there are 3 warning labels here, and one of it says high in calories. But at the same time, and it is like marked in another circle, the industry were using the GDAs, right? And the GDAs are in this white oval, saying that one portion of the product is 112 calories. However, the package have 5 portions. So as you can see, it is kind of confusing, right? Like having multiple information. So this was one of the industry tactics that they started using to hinder the effectiveness of the policy. Another one that I'm not gonna go over is the one that already my colleague explained, but the use of non-sugar sweeteners were replacing sugar. And this was all, again, explained already by my colleague Nelly. And moving over to Peru, and can you go back, please? One slide, yes, here. Moving up to Peru and Argentina, what happened is that, of course, as Nadia showed in the evaluations of Chile, industries reformulating the products, right? And these reformulation efforts led to using the fact of not having labels as a marketing strategy of ultra-processed products. And why this is a problem? Because the evidence shows, and this is a trend happening worldwide, that ultra-processed products are displacing traditional diets, right? So that's a problem about like the reformulation of ultra-processed food, because that doesn't mean that we will have like a healthier product, because these substitutes, of course, use different chemicals and different ingredients, such as additives, colorants, among others. And if we add another layer that is not the focus of the presentation, but it is important to highlight, is that it is not just affecting the human health, but it's also affecting the planetary health. So the amount of plastic and pollution that these products are creating, it's huge, and we cannot ignore this fact. Next slide, please. So from Mexico, we have learned a couple of lessons after the front of package warning label implementation. And this slide will focus just on the packages. So starting with the image in the left, we have some cookies, milk products, and rich fat cereal products. So what the industry used, they were using the same front of package in the back and in the front of the product, and disputing that who can claim which was the front of package labeling. So they were using double fronts to confuse and display the products as they wanted. Same with the cylindrical containers. They were arguing that nobody can say like which one is the front of the pack of the label, so they were displaying the products in a way that you can hide the front of package warning labels. And another strategy with the package were that they started developing or like throwing to the market these huge containers featuring packages without labels. And of course, consumers were attracted to those consumer products without the warning labels, again, hindering the effectiveness of the public health strategy. Next slide, please. So there were also some lessons learned regarding the point of sale and marketing strategies. So in Mexico, as many other countries, those products that displays a warning label cannot cannot use marketing strategies to appeal to consumers. And this includes, of course, like the use of different characters. So when the implementation began in Mexico, we were seeing employees wearing a kind of uniforms representing the cartoons, of course, trying to appeal the consumers' attention to buy the products. Another strategy that was used is that the cartoons were moved from the package to the container boxes, and these boxes were displayed in the aisles of the supermarkets to carry these products carrying the front of package warning labels. And lastly, regarding the marketing strategies that very creatively the industry used, is that cartoons were moved from the package to the product itself, and as you can see, they were starting to use crystal clear packages, so like people can clearly see the cartoons. And also, they were using branded gifts with the character, but displaying that the character was not part of the front of the pack, but it was displayed in the gift that it was like another product, right? That is not the food. Next slide, please. And from these marketing strategies, in Mexico, it was shown like increased digital marketing efforts of products banned on packaged with warnings. And also other strategies that the industry were trying to use are, for instance, let's focus on the image in the middle. We have some chips, right? And it displays a warning label saying high in calories. But at the same time, they were putting like some stickers over to cover that warning label saying super crunchy, trying again to appeal the consumer and increase the purchase of these products. And in the last product, that is a purple one, that is a sauce, it displays a claim of excess of sodium, but at the same time, they use the same design of the warning label, but to promote the product, saying excess of flavor. So these are the kind of strategies that the industry uses to hinder the effect of the policy, and that we should learn as countries to improve the countries, to improve the policies in the countries, and have a very strong policy, of course, to protect public health. That is the purpose of the policy. Next slide, please. So let's talk about the solutions to these lessons learned and some of the best practices that you can have in front of package labeling. First of all, front of package label should be mandatory, and it should not be seen as a single strategy, but as a part of a broader policy package to tackle non-communicable diseases. Next, the policy-making process should be protected from vested interest, and of course, when you have industry sitting at the table at the policy-making process, it is obvious that they will protect their profit interest over public health, right? So another lesson learned from all the evidence generated, and that also my colleague already mentioned, is that the warning label is the best performing in changing purchasing decisions and perceptions about unhealthy products and reduce their demand. This is a system that is very quickly to understand, and it has shown effectiveness. The other point that we didn't talk about, but is important to highlight, is to include the authority endorsement. So if you can see the image to the right, there's like very little letters below the excess in certain type of nutrient, and that's like the Ministry of Health or the Department of Health. So basically that provides credibility to the front of package warning label and over the whole country, right? Then it is very important to include in the policy where the front of package labeling will be located. So it should be located in the main panel, and the label should occupy a prominent size of the panel. The other thing is that warning labels should be displayed in all packages, despite the size of the product. So for instance, in some of the countries, in very small products, instead of putting like 5 of the labels or 4 of the labels, they just display one warning label with the number of warning labels that the product should display. In that way, it doesn't matter if the product is like super small, but it will comply with the policy. And of course, as previously mentioned, we should use country experience to avoid loopholes in the policies and to create stronger and stronger policies with the lessons learned. And the last 2 recommendations are based on the nutrient profile models, because if we have the best front of package label, but with a very weak nutrient profile model, the effectiveness of the policy will be very much affected. So it is highly recommended, and this is kind of like the core of the policy, that the front of package labeling should be guided by strong nutrient profile models, like the WHO ones, that are based on the best scientific standards without conflict of interest. And lastly, the nutrient profile models should be ingredient and nutrient specific, and also going beyond solely nutrients of concern, and include markers of processed and ultra-processed products like non-sugar sweeteners, additives, and others. Next slide, please. And to finish the presentation, I will talk about 5 industry claims that you might hear when you try to incorporate or adapt a front of package labeling in the Philippines. The industry claim number 1, it's that different types of front of package label would increase cost for producers. This is a typical argument from the industry, and you will start hearing, well, front of package label is trade restricted, it is costly, it will be time consuming to implement, it will have financial implications. It will affect small companies and medium companies. However, we all know that companies can change their product constantly. For instance, if we think in Christmas, they change their products to adapt their products into the Christmas seasons, right? So that should not be pushback for the policy. Also, the cost incurred by the industry have the potential to be outweighed by the savings in healthcare costs when implementing a strong and an effective public health strategy as a front of package warning label. Next slide, please. Industry claim number 2. FOPL violates codex and other international trade agreements. So it is very important to understand that codex does not prevent countries from adopting evidence-based front of package labeling measures to protect public health. So the mandate of codex is to protect health and trade, right, to promote fair trade. But if a measure protects public health over profit, that's completely acceptable by codex. So this is not an argument that we should buy. Next slide, please. Industry claim number 3. The traffic light, or like the color-coded labels, are preferred by consumers. So here it is very important to highlight that is very different preference to effectiveness, right? What do we want? Do we want like a system that is preferred, or do we want a system that is effective for all the population? So basically, the industry says that like the traffic label is preferred by consumers, again, because they are attracted to the colors. However, the research shows that traffic light label does not change purchase decisions and performs worse than front of package warning label. And that front of package warning label helps consumers more quickly to identify products with high contents of unhealthy nutrients. Next slide, please. Industry claim number 4. Individuals can make personal choices about what they eat, and they are responsible for their own health. So this is a typical argument that that the population should be responsible of our own purchases, and even we should be responsible of the purchase that we do to our own homes, right? So, however, the evidence has shown that consumers have trouble understanding back of the pack nutrition labels. They need to have math skills. They need to be able to read, and they need to have time to understand and process information on the back of the pack. Next slide, please. And the last industry claim that I want to share with you is that front of package warning label is trying to scare consumers from buying certain food and beverage products, right? So of course, the warning label is kind of an aggressive system, and they would say that it is too harsh and will make consumers anxious. However, the front of package warning labels is evidence-based, as we have shown, and is easy to identify. And consumers do not find front of package warning label to be harsh. On the contrary, it empowers consumers to make informed choices despite their education and socioeconomic level. So I want to close up that front of package warning label is a public health strategy that actually increases the health equity in any country. Next slide, please. And with this, this is the end of the presentation. And again, we want to thank you for your time. And I'll pass it over to Nadia if you want to say like last words.
No, thank you so much, Sophie, for this presentation. Thank you, everyone, for having us here. We're happy to discuss this further or provide any inputs or resources that you might need. And good luck with the rest of your day, and thank you again for having us. Bye.
Thank you. Kala mo live eh. Thank you, Miss Sofia Patino and Miss Nadia Flexner from the Global Health Advocacy Incubator Headquarters in Washington, D.C. Muchísimas gracias. Ayan. Chabacano. Nagpretend na Mexican. And now, we've come to the most amazing part of this program. Bukod syempre sa lunch, ay yung ating open forum. So we'd like to call on Director Rodley Carzal of the DOH-HPB, and Ma'am Jovi Rabal of the NNC, Dr. Maria Belia Ponferrada of the UNICEF Philippines, and Dr. Vico Ubaldo of Imagine Law. Mr. Carl Vincent Cabanilla of FNRI, Dr. TJ Moncatar of UP College of Public Health, Sir Ralph Degulacion, ang ating co-convener of Healthy Philippines Alliance, and Mr. Mike Entoma of SWS. Sige po, dito po tayo sa ating PBB House. Ayan. So, kayo naman po ang magsasalita ngayon, no? Kayo po yung magbibigay po ng mga questions sa atin pong mga panelists. Ayan, ma'am. Peram pa nga po ng mga mic natin. Yan. Sige. So kung nahihiya po kayong magtanong, pwede pong magpasa na lamang po kayo ng question or if you don't want to. Yan. Ito pa po ang mic. Naka-off pa po yan. Questions po from our Sir, sorry po, nauna po si Director ba muna? Sige po.
Okay, good morning. I'm Randy from Department of Agrarian Reform. I would like to address this question, actually not a question, but an appreciation to the presentation done by Mr. Entoma. Precisely in one case, which is when you presented the octagonal, the result was something like catchy, and the appreciation of those participated in the survey says that they accepted the octagonal, presenting a more alarming warning like high in sugar, high in salt, comparing to the nutrition-based like the color-coded or the traffic light sign. Since most of the presentation, it looks like the pattern is the same, it's more give an informative signals to the consumers if you put the warning signs that if you might have a disease or die having this. Perhaps if we could push to adopt that particular sign, which is already established, a significant result that that particular sign gives more attention to the consumer, having the result coming from the SWS and the other presenters. Most likely, if we can offer this also to our legislators so that you can adopt that particular sign instead of having some assessing other signs. I would like to pause for that presented by the SWS. Thank you very much.
Sir, you would want to react po?
Hi, sir. What we noticed, given the findings, if we may be allowed to give a hypothesis as to why the results were such. That format, kasi sir, is more direct to the point. The language is simple, understandable, and as Sophia pointed out in her recorded message, having the name of the Department of Health in the sign itself instantly gives credibility to the warning sign. So I think that's very helpful for people to identify it as, hey, importante, dapat mag-pay attention tayo dito sa ganitong signs. Kasi I think the other signs involve a lot more processing of scores and the calculations. I could liken it to if you have medical results given to you by a doctor, you will also search for an interpretation of it, a direct interpretation of it, instead of processing the numbers yourself. So that's what I think, sir, ganun ang nangyari. Simplified, direct to the point, and in simple language is effective. Thank you.
Thank you po. Next question po or comment.
Thank you po. Again, I am Paulo Ordobes from the Council for the Welfare of Children, or CWC. I'm with Miss Cristel Luis Soriano. representing CWC. First of all, congratulations to the team, specifically to NNC, and as well as UNICEF and the rest of the team for putting this event specifically to discuss the important of label, especially doon sa mga products na binibili natin. First, the question is, any data or any research pertaining to doon sa mga research panel na nandito na kinandak pertaining to children, specifically 18 below, sabihin na natin hanggang 11, kasi sila yung madalas na bumibili sa mga tindahan, at ano yung naging result doon sa naging research na yon. Yun yung una po. Sige, yun na lang po muna. Tapos sunod na lang po yung question.
Hello. I'll try to answer on behalf of the panel. So in the presentations, a lot of the studies, actually almost all focus on age 18 and above, particularly because in the research field, yun yung standard cutoff in the ethics clearance. But in global evidence, I think yung actual implementation already covers the age group. So we learn from the actual experiences of countries already implementing, and I don't see that the results are very much different from the research conducted here in the Philippines. But I appreciate your point, and we recognize that that's as a very important component. In fact, in one of our meetings, we highlighted that we need to consider the children because they also have purchasing power, and they are the ones being marketed to for these particular products. And I hope of all the research presented a while ago, it's actually the UP CPH studies, the perspective pa lang. So we hope that they will be able to accommodate targeting also or covering children below 18 years of age.
Yeah. Thank you po. Again, si Dr. Mongkatar suggest kanina na yung mga list of agencies, CWC will appreciate po kung sakaling magkaroon po ng pagkakataon na ma-invite. Ang pinanggagalingan po kasi noong question is yung naging outcome and output po noong practice and behavior ng PIPAN, which is UNICEF presented the CPC 9, which was held at Joy Nostalgia, pertaining to nagkaroon kasi ng discussion pertaining to parents caregiver of 3 to 5 children demonstrate responsive caregiving, nutrition, children 5 to 10 years old consume healthy diets, and others pa. Ang dahilan din po kung bakit din po siya natanong din ay dahil sa, again, nabanggit na po ninyo na may consumer power talaga yung mga bata, at talagang yung mga bata ang directly na concern natin dahil lang isa sa mga iniimpo natin ay mabawasan yung obesity and overnutrition doon sa mga bata. Though tayo, the adults, has also power na bumili ng mga products, tapos nakikita naman natin yung label. Pero maganda rin kasi na maituro din natin sa bata yung usapin ng label. We do appreciate po kanina yung sa survey ng SWS na merong Tagalog talaga. Dahil yun yung important. Dahil mostly, ang bumibili ay mga bata at hindi naman nila maintindihan talaga kung sakaling English to, or maaring hindi naman natin minimenos yung kagayahan ng mga bata. Pero mas marami pa rin sa mga bata at sa mga adult, yun nababasa, yung Tagalog talaga. So, yun po. We hope na magkaroon din po sana ng survey pertaining to 18 to 15 to, may age bracket, para mas ma-identify natin talaga, which is UP, siguro yung susunod na. So, malaking task siguro yung ibinibigay. Pero magandang, ang dahilan kung bakit binabanggit ito ay yun yung magiging isa sa pinakamagandang best practices ng Pilipinas na hindi nagawa sa ibang bansa. Kasi during the presentation on global, ay napansin na puro mga adult talaga. Pero baka pwedeng maging ano siya, best practice ng Philippines na ma-present na meron kaming ganito sa age na ganito, age bracket, pero bata. Tapos, ito yung pwedeng may approach na mangyari. So sa FGD po na magagawin po ng randomized research, baka possible po makapag-invite din po. Nabanggit nga po ninyo, ibang mga NGOs. Pero better yung mga civil society is focus talaga sa bata. So yun lang po. Marami pong salamat.
Thank you, sir. Meron po tayong... ay, sige, ma'am.
Idagdag ko lang no kasi naging bata din ako. Oo nga kasi ang pera mo, magkano lang nun? 25 centimo. So punta ka lang sa sari-sari store. Eh ngayon pag yung mga bata ngayon yung tingi-tingin tig piso-piso, 2 piso, which are mga small micro industries no which will not likely be covered by FOPL no. And more likely, baka hindi rin siya makover dun sa mga for marketing regulation in schools. And since normally they are not being marketed to children kasi maliliit lang siya, hindi rin siya ma-capture sa marketing regulation, no? So, yun talaga yung gap kasi yun naman yung iba yun na yung inuulam, di ba? Yung may mga lechon manok pero yung pala cornic pala yun, no? So, isang gap nga talaga yun. So, and I also see the value of consulting children. So, baka yung protocol ninyo may not fit the way that we should be consulting children. Kasi when you also regulate marketing, tatanggalin mo yung mga action figures, yun pa naman yung gusto nila, no? So, ang lulungkot ang buhay nila kasi pagpunta mo dun sa fast food, babawal na yung mga kiddie meals, wala na yung mga toys. So, baka mamaya ayaw pala nila, no? So, so, kailangan makita rin yung point of view nila. So, baka dapat may pasok sa ating mga work plans din. Salamat.
Thank you po. We have another question po.
Salamat. I'm May Mendoza from Health Justice. So, tatlo yung tanong ko. Pero una, hindi naman tanong. Gusto ko lang magpasalamat kay Rodley, Department of Health, and also sa FNRI and NNC. No? Kasi your presence here, as well as the other experts, will show talagang large support for this policy. And it augurs well, no? Kasi ang laking support that this may pass sa Congress. No? Number two, I think our concern is now how do we bring together all this knowledge and information that were presented by our experts, no? In some way, so that yung gagawin na research ng UP College of Health, parang value added, no? Kita mo na, I think it will help you kasi meron ng initial, no? So I think yun yung isa nating concern na makita. No? And of course, hindi ko alam kung kailan mag-start ang hearing sa Congress kasi yung research nila sa December pa. No? So yun lang. And then of course, my third issue was yung ni-raise yung ulit si Nadia ba yun? About interference of the industry, especially the food industry. Kasi nakita na natin yan sa interference ng tobacco. At in the past, magkasama ang tobacco at food as one conglomerate, no? So isang conglomerate lang, Philip Morris, Virginia Slims, plus yung Kool-Aid at yung favorite natin na Kraft Mac and Cheese. So nasa DNA ng mga industry ang uh, interference sa ating policy. So siguro kailangan nating bantayan kung paano sasagutin ang mga tanong like na-anticipate ko na tatanungin ng mga legislators natin. Anti-poor yan, di ba? Anti-poor kasi yung mga kinakain naman na yung mga pagkain dito like Lucky Me noodles, di ba? Mas mura yun. Or 3-in-1 coffee. Kasi yun na ngayon ang kinakain ng ano. So, yun lang ang aking isang tanong. And of course, related to industry interference would be yung sa mga government agencies like DOH, FNRI, DOST. It'd be good to anticipate that there will be no conflict of interest. Kasi easily, we see that I'm very candid, some of our research sponsors are from the industry itself. So yun ang isang issue natin. So yun lang ang aking concern. So I'm addressing this question to the government sectors. Salamat.
Thank you, ma'am. Baka meron pong gustong mag-react po.
Sige, thank you, May. Well, at least for the side of the department, we fully agree with the points that you've raised. That's why we're also coordinating and collaborating with all of you so we can have a harmonized efforts towards the passage of the FOPL bill. And hopefully when the Congress calls us to provide the recommendation, we can push forward a unified joint recommendation to the Congress of what FOPL scheme should be passed in the Philippines. So our platform for that is our Healthy Diets Technical Working Group, which a lot of those present today are a part of, including, of course, DTI and DILG and Department of Agriculture. So we hope that we'll be able to push forward a whole of government and whole of society position in terms of FOPL in the Philippines. I also recognize the limitations of the hearing might happen anytime soon. The Congress may call since there are also bills filed already and the research of UP is still pending. That's why our call to all here today is to be able to provide recommendations to the Congress based on the best available evidence, scientific evidence. My remark during our TWG meeting is that we should not be beholden to the results of our own research. Let us not be limited to our own research, but let's welcome research globally, the best practices and what the literature already says. But of course, additional context, local research is very much welcome and value adding. Third, we fully agree about protecting our public health policy. And you know, this is a public health measure, and anyone who will oppose public measure is anti-health and has no place in the Philippine development natin, no? Kasi we really need to protect the rights of our Filipino people in terms of their health, and of course the rights of the children in terms of their welfare. So we hope that the food and beverage industry will be supportive of our efforts, because otherwise there will be difficulty, no? Especially based on the experience globally. And our call to our partners here today, especially government ones, please be able to set boundaries in terms of the participation of the industries and manage the potential conflict of interest that might arise in the work that you do in terms of research, policy development, legislation. So it's not bad to consult them. It's part of their process. There is public consultation, stakeholder consultation that will happen. But we shouldn't allow these activities to influence the decisions that we are making in terms of public health. So public health must always take precedence over commercial interests. So that is our call to all our partners here present today. Thank you.
sagot kami kasi government po. Yes, I agree po, Ma'am May, regarding your comment. Actually, the development of front-of-pack labeling, the new system project ng FNRI, we're following the WHO Framework Manual and Guiding Principles. And it's one of the key principles na talagang i-manage itong conflict of interest po natin. So yun, please be assured na the expert panel that we're going to invite, the members, are free of any commercial interest. And also, I'd like to commend then our new OIC director, no, nagbigay talaga siya ng explicit instruction to us na not to at least for the expert panel, not to involve anyone from the food industry, food and beverage industry. Yeah, thank you.
Dr. Palma po from the Philippine College of Lifestyle Medicine. First, would like to appreciate your invitation to involve the medical societies here in this discussion for the policy research and advocacy. This is highly commended because we know very well that not all doctors are well versed in nutrition. We are very deficient in terms of nutrition deficiency. This is not only in the Philippines but all over the globe. But we know that to mitigate non-communicable diseases, which could be food-related, then we have to be knowledgeable about nutrition. My question is just, how can you actually share these contents, this research, so that these contents can be also included in the subject that we talk about in our medical societies? And because I know that this is population-based, and community engaged interventions that you're doing here. In terms of the medical society, we're more of patient-centered. And we know though in lifestyle medicine, we deal with chronic conditions. IM deals with chronic conditions. And even children, there are a lot of chronic related diseases already, basically because of food-related things. And so intervention can really be helpful to them. So we highly appreciate these things that you're presenting now. My question would be, can this be cascaded to the medical society so that we can have this data as well, so that we can include this during our medical conferences? You know, when it's not talked about during medical conferences, we will never be updated. Thank you so much.
Assurance po. Sir Ralph.
Tinawag ako ni Sander. No?
Wala siya nagawa.
For Healthy Philippines Alliance, Doc, thank you very much for attending this forum. For Healthy Philippines Alliance as a civil society network, we assure you that we are very much willing to actually participate if needed, because we have a website, we will share all this information publicly, and I think we also, this is live streamed as of the moment. But in the future, if you will be inviting civil society, then we can present our case, our what we think about this kind of policies. Because for us as civil society organizations, anything that protects our patients and especially the public, we will be supportive of, especially if it's evidence-based and free from any commercial or vested interest. So it's very important for us as the Alliance, the Healthy Philippines Alliance, to share and impart. And maybe also our patient advocates can also be a living testimony of how these kinds of interventions will be beneficial to us. So we're open to invitations, and we can also provide anything that we have. Our materials are openly in the public, and you can also email us if you have very, very specific information needs. So that's how we can share and we can participate in the discussion with our medical society. So thank you po.
Currently, no, we engage yung Philippine Association for the Study of Overweight and Obesity, no, and they have also annual conventions, no, and I think nag-attend si lifestyle medicines, endocrinology, yung mga diabetes na experts, no, so that can be one platform, no, and it's very important talaga for the medical doctors. In our recall survey, the second source of information are the doctors, no, next to television. So, very important talaga that we are saying the same things, especially now that there's increasing recognition of obesity itself being a chronic disease, no. So, if this law will be passed, then there should be efforts to educate all the different stakeholders so that we ensure that consumers, even patients, understand FOPL plus the other interventions to promote healthier diets.
Just an additional appreciation to the panel. We highly commend what you're doing, and this is in the government sector, and that there is a huge confusion in terms of food prescription, nutrition prescription between doctors and different specializations. So having this evidence-based intervention, public-based, and so that we can convert this into patient-centered intervention will really be helpful. As you have said, ma'am, the second information that people will get are from doctors. So what's going to happen if doctors are confused? So what will we tell our patients? So I believe this will be really helpful information. Thank you.
Thank you. Last one question na lang po ba? Or meron pa pong hahabol? Malamig na yung kanin eh. Sinilip ko sa labas.
Good afternoon na ba? Nagugutom na si Sir. Sir, I'm Dr. Subia, another doctor representing the Philippine Society of Pathologists. So, kami po sa mga pathologists, so kami na po yung end result ng pagiging malusog natin, no? So, oo, kami po yung nagtetest ng mga cholesterol natin, blood sugar, creatinine. So, yan po yung, and kami na rin po ang nagda-diagnose ng cancer. So, by experience, dumadami na po talaga ang mga non-communicable diseases like diabetes, younger age, marami na. I'm also from Philippine Heart Center. So, marami na rin po ang sobra-sobra po ang cholesterol, mabilis tumaas ang creatinine, and the likes na sakit po, no? So ngayon po, ang question po namin is, ano po ba talaga ang tamang age natin to educate the consumer? Kasi po, I think, ang napansin po namin is, yung mga mothers na hindi na-educate during childhood, they would just pass down to their kids kung ano yung food preference nila. So our concern here is how do we target the consumer? So ang isa po naming napansin, like yung implementation ng education natin is, example, in government offices, mandatory sa atin yung, or any kind of offices, mandatory sa atin yung seminar about sexual abuse or sexual harassment. Bakit hindi po natin ilagay din doon sa part na yun na may ganun din po tayo, like you are working on healthy diet technical working group. So sana po masama po yun sa ganon. And then also the children, we should instill on their young minds how to choose yung proper food natin or proper choice natin. And also, yung question ko po about dun sa survey module, about the nutrition facts, may nakalagay tayong mataas sa asin or sa asukal. But do we include daily consumption? Kasi di ba yung parang sa nutrition facts, meron tayo doon daily consumption. Pero hindi naman yung babasahin ng bata. So, mataas sa asin, parang dapat siguro may nakalagay tayo na yung asin natin for that day is dapat ganito lang. Kasi yes, mataas to sa asin, pero later kakain ulit ako ng asin, may asin. So, yung normal value or normal consumption for the day should be included. So at least meron tayong awareness na sumobra na ako sa asukal or sumobra na ako sa fats or sa asin. Yun po. Thank you. And actually, yun nga pala, we are very much willing to help po as group ng pathologists in this kind of activities. Thank you.
Thank you, ma'am. Si Dr.
Hi, I'll answer the first question that was on children, right? How the age. Actually, there's really no limit, in terms of educating. But we need to make sure that the content and delivery are tailored to the audience. For example, you tailor what message you bring to the children. But more importantly, I've been saying this in every forum that it's very important to start early. Really, we can never underscore this enough, because when we start early, both the physiology of the body, the child, and also the behavior we establish the trajectory of both of this early on. And this is what is being carried into adulthood. This is already, there is a robust theory behind this, the Barker hypothesis, thrifty hypothesis. And this is really, when there are deprivations early in life, this has enduring consequences into adulthood because of epigenetic changes, in the functions of the genes. And this is very, these are highfalutin, terms, but this is medically backed, that this is already, there is strong evidence that when you have deprivations early in life, early childhood, these are the shared pathways for both undernutrition and overweight and obesity. That's why this is always, it's important that mothers, the primary caregivers, not just the mothers, are educated very early on what foods to eat. It's not just the food, the behavior itself, also physical activity, all the package. So yeah, that's for the first question.
Susugan ko lang din yung sinabi nila. There's really no age of what's the best time for us to teach. As emphasized presentation ni Chino, it's really a life course approach. So each life stages, there are literacy needs. And based on our health literacy assessment, we really found that in the Philippines, mababa talaga yung literacy natin. And that's highly related to our educational literacy. So for example, hindi ka na marunong magbasa or magsulat, how much more yung health information will you assess and appraise and understand and apply, diba? So it's really important that as early as possible, we teach them of the proper diet, healthy diets, and other healthy behaviors. That's why DOH is also working with DepEd in our work with Healthy Learning Institution. Nutrition is a component of that program, wherein we promote healthy behaviors for nutrition, kasama dun sa yung policy nila against selling junk food in the workplace, in the school canteen, in the inclusion of the nutrition information in the curriculum. Lahat po yun, kasama namin yung DepEd in promoting the health and literacy of the children. Sa workplace, very much relevant. Recently, we are working with DOLE and CSE. We launched the Healthy Workplace Toolkits, wherein certain programs are being implemented in the workplace. And as a matter of policy, we are promoting all of them. Right now, we have 4 toolkits. Unfortunately, wala pa po sa nutrition, but please expect that DOLE and CSE will be releasing, with DOH of course, releasing soon more modules about this. No? So very much well taken po. Third, in terms of communities, we're working with the Healthy Communities TWG. Pasensya na po, ang dami po namin TWG. Pero ganun po kasi talaga kalawak yung trabaho natin in promoting the health of the people. So we're working with 15, along with 15 national government agencies to promote healthy communities. And one of the standards and indicators of that is actually good nutrition. So this year we'll be recognizing local government units who are promoting healthy communities, including nutrition outcomes. No? So abangan nyo lang po, marami pa po kaming ginagawa on promoting the health and nutrition of our countrymen. But I would like to very much express my gratitude then for the openness of the medical societies in working with us. As I've mentioned in my opening remarks, clinical management shouldn't only be the intervention of the health sector on this. So we welcome the interest of the medical society in working with us sa mga interventions outside of the clinical setting, outside of your clinics. No? So, and perhaps I'll take this opportunity to make a call for our medical education institutions. If you can please highlight in your curriculum nutrition and other parang directly health service delivery na intervention sa promotion of our health. Health promotion, for example, in the medical curriculum is very sparse. Hindi masyadong nag-uusapan. But I think if we really want to promote the health of our clients, this is something that we really need to teach our health professionals in the country. So I hope for those who are working in the field of health education and medical education, please consider including nutrition as one of the topic and improving or broadening the health promotion component of your programs. So again, muli maraming salamat po sa Department of Health for all your support.
Hi, I'll just add to the answers to the question. So thank you for those questions. Again, I'm Doc Vico from Imagine Law. So with the first concern regarding the education of children, with the policies or with the bills that have already been filed, actually they already include an information education campaign, which includes working with the Department of Education to teach nutrition in schools. So that is already part of the proposed bill. So we definitely recognize the importance of also educating children. On the other point, regarding the label itself, the possibility of adding another piece of information which tells you how much of that nutrient you've already consumed for the day. So I understand that this is a very important piece of information, but we have to also balance the fact that the more information that you put in the front of the package, the more it may tend to get ignored. That is one of the downfalls of that is something we need to consider. It is definitely important information, especially for some people who need to actually compute these. But again, you can already compute these using the back of label. So we have to align the objective of the policy with what you will end up, what kind of label you will actually put in front, which is that piece of information the amount of the exact amount of nutrient concern to put in the package, will that align with the objective of decreasing consumption? And so this can be a valid point of research, but again, with the best practice that has been established in other countries is that this is not necessary information for a large majority of people. So again, this is a very valid point, but let's just align with the objective first. Will that kind of information actually change consumer behavior? And if not, maybe we may consider not having it, not having that piece of information in front, but for those really concerned, it is still available for them to compute using the back nutrition labeling.
Yeah, pasensya na po, dala ko na rin talaga yung bag ko, palabas na ako, pero dahil may susunod na mga meeting, but I could not pass on this opportunity for possible collaborations. I'm Carol Raico. I'm from the Philippine Mental Health Association. We're often mistaken as a government agency, but we're not. We're a NGO po kami. Ang question ko po, did any of the researches or surveys conducted
consider the component of mental health. So that's one. And then, ang context po kasi niyan, sa Philippine Council for Mental Health kasi, which we also actively participate in, there's already a reorientation of mental health, which is the biopsychosocial spiritual framework. And in the biological framework, we know that nutrition is an important component also. So, kung wala pa po doon sa mga nagawa na surveys or researches or sa gagawin na research, how open, I don't know to which government agency or institutions here now can I address this to, but I'd like to know kung gaano ka-open po sa collaboration in terms of research on nutrition and mental health. So I think that's very, very important. No? Thank you very much.
Sige. So, siguro sa DOH, we don't have a specific study that directly correlates mental health and nutrition as of the moment. But our health promotion and literacy survey assesses both nutrition and mental health. And it can be analyzed together. No? So I think on our behalf, on the DOH behalf, we're very much welcome to collaborate and see this. We are also sitting part board member of the PCMH, so definitely this will be a work that we can do together.
Meron pa po.
Yes, Ma'am May, tama po ba? Sorry, Ma'am Carol pala. From Mental Health Association. We had a proposal before to conduct a research on the link between nutrition and mental health, but unfortunately this was not funded. This was in collaboration with Natasha Gilburn Foundation, and it's supposed to be conducted in Iloilo. It's called the Katatagan program. So we're open po for collaboration if you're interested po to pursue yung yung study between the link between nutrition and mental health. Thank you.
Thank you po. So to wrap up po yung ma'am, meron kang sabihin, ma'am? Wala na.
I mean yung science is there that if you lack certain nutrients may affect sa mental health, no? Pero in terms of practical, we haven't really done anything much on that, no? So, di ba pag nag-away kayong boyfriend mo, mapapakain ka lalo, ganun. So, o hindi ka kakain, walang appetite. Correct. So yung mga ganon. So, perhaps, no, we can collaborate, no, and do something that translate into practical terms on improving behaviors of people na yung may mental health issues should not result to poor nutrition.
Ayun. And to wrap up lang po, to summarize po yung mga salient points ng ating Q&A. Number 1 po yung inclusion of children in research. And then number 2 yung education as a complementary strategy for FOPL. And yung the need for information sharing to various stakeholders. So thank you very much po to our panelists. Pero wag po muna kayo umalis. For our closing remarks po, Sir Ralph De Golacion. Oo, dali na, ikaw na. Andiyan ka na rin naman eh. Dali na. Ayan. Dito po kayo sa podium for our closing remarks. On the spot closing remarks.
From panelists to closing remarks. So, okay. So, good afternoon na po, and I will not make it long now. Again, on behalf of the Healthy Philippines Alliance and our partners here, the Department of Health, National Nutrition Council, the DOST FNRI, Imagine Law, and SWS, UP College of Public Health, and of course, UNICEF. We're very, very thankful for your presence, and we acknowledge your importance that you play in this very important discussion on front of pack labeling. Lahat po tayo dito, I'm sure you attended because this policy matters to your respective advocacy or institution. So I think this is a proof that what we are discussing is really something worth discussing and pushing for, no, improving it. Kasi we saw in the research there is something wrong talaga with the policy, or we have to improve our policy already kasi we are seeing an avalanche or a exponential growth of NCDs in our country. No? Hindi na po natin mapagkakaila that NCDs is already ravaging our country, and it's getting younger. Yun yung worry namin at the Healthy Philippines Alliance. Kasi po sa amin, we are NGOs, CSOs, and patient groups. We are seeing how younger Filipinos are silently suffering from these kinds of diseases. Hindi nila matrace kung saan ba nila nakuha. It could be genetics, that's one. But I think on a bigger, siguro sabihin na natin outside the family, malaking bagay po yung environment and of course yung diet that they have also. No? And our resource speakers already discussed that in detail. I think for us, Healthy Philippines Alliance, we will continue to consult and talk about this issue with our patients and our communities. Kasi we want to bring this to the attention of the government and to our legislators as well. Kasi many of young people, young Filipinos, families are really parang looking for solutions on how to prevent and how to sort of improve the life that they want, diba? Parang the front of pack labeling is just one of the many package of interventions that we need to do. And doon sa nakita natin sa mga resource speakers natin, putting a label matters and it can save lives. Sabi nga namin sa Healthy Philippines Alliance, even one person na ma-save natin out of this intervention means a lot already. And what more, if our government will be able to do this and our society will support this, then all the more we can save thousands or maybe millions of Filipinos from being just silently, dying because of chronic kidney disease, of heart conditions, even cancers, di ba? We don't want our Filipinos, lalo-lalo na po yung mga in the far-flung areas, to just die because they didn't know what they were eating, they didn't know what they were doing, and those are things that matters. Na tayo pong may alam at tayo pong nakakaalam will be able to intervene and will be able to propose solutions that will benefit our kababayans. And I think the front of pack labeling, particularly, of course, yung warning label, sana yun yung tinitingnan namin kasi dun sa SWS survey that came out, that's an initial indicator. But of course, we recognize that we need to do more focus group discussion, and maybe the researches that are coming out and will be done will concretize that initial findings that we have. So for us at Healthy Philippines Alliance, we will support and we will be there to actually drum up support for front of pack labeling. And yung front of pack labeling, that will be very easy to understand for our kababayan. So again, maraming salamat po. I hope this will be a start of more collaborations with all of us here in the room, and see you again. Maraming salamat and have a nice day. Have a nice weekend.
Thank you so much, Mr. Ralph Degulacion, the co-convener of Healthy Philippines Alliance. For our panelists po, please stand po for our pictorial. Huwag po muna kayo lalabas kasi meron din po tayong para po sa lahat. Ano po? Thank you so much po, Director Rodley Carza of DOH Health Promotion Bureau. Ayan. Si Ma'am Jovi Raval of NNC, National Nutrition Council, Dr. Maria Belia Ponferrada of UNICEF Philippines, Dr. Vico Ubaldo of Imagine Law, Mr. Carl Vincent Cabanilla of FNRI, Dr. TJ Moncatar of UP College of Public Health, Sir Ralph Degulacion, and Sir Mike Entoma of SWS. Yung next na photo raw po ay bababa po kayo sa harapan po ng stage and then facing the stage, at lahat po ng participants po ay magko-compress po dito sa gitna para po kita po sa picture. Ayan. Habang kayo po ay nag-aayos, meron po akong program sa radyo, DZXL 558, from 5 a.m. to 7 a.m. Kung gusto nyo po kunwari po may mga events po kayo na gusto nyo pong ng interview or advocacies, kontakin nyo lang po kami sa Facebook at baka po sakali na. Pero yung mga ribbon cutting, wag nyo na hong ipa-cover yan sa media. Hindi yan ire-report. Alam nyo naman ng mass media, di ba?